and highly respected experts within that field. Thank you, Shorat. Ahmad Mourad, who serves as the Senior Director for Strategic Solutions Experimentation for Medical Devices at Johnson & Johnson, and Saqib Chowdhury, colleague of mine at Cleveland Clinic, who serves as the Senior Director for Information Security and the Head of Digital Innovation and Development at Cleveland Clinic, Abu Dhabi. So you guys are in for a treat today. We know that from previous meetings that we've had with the Healthcare Committee membership, particularly the last one, the annual general meeting, this is the topic that was by far the most requested. And as the Healthcare Committee co-chairs, we're very happy to deliver on that request with, again, two excellent speakers. So I will stop talking here, but after I introduce our first speaker, Mr. Ahmad Mourad. So Ahmad Mourad is the Senior Director for Europe, Middle East, and Africa for Strategic Solutions Experimentation at Johnson & Johnson Medical Devices. And he helps drive and ingrain innovation across the organization and shapes the healthcare ecosystem externally through partnership and collaboration. Ahmed has over 25 years of extensive experience in healthcare, telecom, manufacturing, government, and private sectors, spanning North America, Europe, the Gulf region, the Middle East, and Africa. So a man who is very well versed in geographies and in industries. Prior to Johnson & Johnson, Ahmed held a number of increasing responsibility leadership roles at, sorry, the screen changed on me there. So prior to Johnson & Johnson, Ahmed held a number of increasing responsibility leadership roles at BUPA, the National Research Council of Canada, Department of Justice in Canada, amongst many others. Ahmed is an active member of the Europe MedTech and MicoMed Healthcare Industry Associations, two very prominent global associations. He's also published a number of position papers on many topics, and he's also a best-selling book author. In addition to everything else that he's done, he's published a best-selling book titled The 21 Indisputable Principles of Trading. So we're really happy to have Ahmed with us today to give his expert feedback and expertise. And Ahmed, the floor is yours. Thank you for being with us today.
Thank you, Doctor, and good morning, everybody. Let me get the screen going here. So Ramadan Kareem, and happy to be with all of you. Let me see if I can do the sharing. Just give me a second, please. Okay, I'm assuming you can see my slide.
Yeah, we can see your slide nice and clear.
Okay, excellent, great. So good morning, Ramadan Kareem, and thank you for tuning in. It's absolutely fantastic to be with all of you. Many knows I don't do typical, sessions, so this is not going to be a typical digitization session. We're going to talk about, obviously, healthcare and digital healthcare transformation throughout. But I think what I would like to share with you today is maybe, some of the observation and unstoppable forces, shaping our lives and what we should be doing as individuals, but more importantly, as organizations collectively in response to that. Just before we get started, just to stay on the angel side, just a quick disclaimer. We are a purpose-driven organizations, as you know. We blend hard science and ingenuity to profoundly change the trajectory of health for humanity. What motivates all of us is the incredible impact that we make on the health and obviously the lives of millions of people we touch worldwide every single day. As you know, we're one of the largest and most broadly healthcare organizations on the face of this earth. We leverage our expertise not only in medical devices, but also in pharma and consumer to address some of the unmet healthcare needs and also to transform the overall ecosystems of healthcare. In medical devices, obviously, we're known for the general surgery, the orthopedic, the cardiovasculars, also the vision, but also we have a large portfolio in pharma, in neuroscience, oncology, and many other disease state, but also in consumer when it comes to our portfolio in self-care, but also in skin health as well. And sometimes what we do is we actually converge our expertise in the different sectors to deliver, health tech and data science capability, but also to address some of the unmet needs, for example, when it comes to lung cancer diseases and other diseases as well. We invest heavily in innovation. Our commitment is always to follow the science, and we have produced many life savings innovation following that model, and we're absolutely proud of what we've achieved so far. We invest billions of dollars, obviously, when it comes to innovation, so it's absolutely key to us. And despite the challenges we've all had, when it comes to the pandemic, we've never lost sight of our responsibility when it comes to how we continue to collaborate and how we continue to partner and innovate to advance, medicine, products, and innovation when it comes to patient care and consumers everywhere. Now, we have, probably not too many of you know, that we have a huge, comprehensive, global toolbox that we can leverage when it comes to innovation, both internally as well as externally. And what you see on the screen, just some of the areas where innovation capabilities spread across the globe, but also how do we partner externally with incubators, startups, and so on. So again, it's an important element of what we do because we leverage innovation internally, but more importantly, also externally with startups and other companies as well. And now there are many examples of how scientific innovation has actually significantly changed and made a lot of progress. And we're obviously collectively, as an industry and societies, we should be proud of what we have achieved. And obviously this has led to better outcomes, increase in life expectancy, and so on. But we still have a lot of challenges when it comes to healthcare, and healthcare remain to a large degree unsustainable. We still have ballooning cost of care. We still have significant increase when it comes to chronic diseases. We still have a huge legacy when it comes to infrastructure, but also some of the traditional laws and regulations we still carry on. And we still have a lot of issues when it comes to detections of patient symptoms, and obviously the impact and the overall issue when it comes to the healthcare and the burnout and the fatigue that actually causes the healthcare system as well. Now, not too long ago, if you go back, there was a belief, the healthcare providers, the physicians, knew everything about patient and diseases. And we, to a large degree, we were looked at as the source of knowledge and reference by patient and the wider society. But since then, there have been, what I call three major revolutions, if you wish, that occurred and created, what we call a perfect storm in healthcare. In the past few decades, we have witnessed tremendous progress in medical innovation. There's so much more we can do today. There's so much more we know, because there's so much we can actually cure and take care of. Innovation and technology are so much better at delivering care, and also at bringing physician, patient, and obviously data all together. But at the same time, we have more engaged patients. Our patients now, they're more active, more empowered. They are so much interested and knowledgeable, and they are reaching out, they're Googling, they're surfing, and they are coming back with the questions and sometimes challenges to physicians and to the overall health system. Now, if you look at technology, I think there is no doubt in anybody's mind that the innovation and technology has actually changed and altered our reality. And when this reality is altered, we are completely changed as a society, and we can no longer go back and work with the old rules that were previously accepted. Probably many of us on this call are probably what I call the digital immigrants. We didn't grow up with technologies and computers and smartphone, but brought them into our life due to necessity and other reason. Now, the new healthcare patient, the new generations of physicians, the new healthcare workers are the digital natives. And they have completely different approach to what technology is for, how they use it, what they do with it, and obviously what they expected from it, and what they expected from all of us as healthcare professionals. We have grown as a digital immigrants with the with some expectation when it comes to technology, healthcare services, and patient experience. The digital natives are growing up with completely different expectation, very evolving expectations and experience. What you see on the screen is, this is my son Anas. He is an asthmatic child. At home, we have Siri, Amazon Echo, the Google Home, and he talks to these gadgets probably a lot more than he talks to us. And he trusts these technologies for not only for his homework and when he does his project, but also he communicates to interact and to get, the soccer game schedule, but also to manage his medication as well. He talks to Google Home to remind him of his medications. I mean, he leverages those gadgets for all aspects of what he does as an individual, as a student, but also as a patient. Now, technology like 5G is bringing new opportunity for healthcare. It's improving, obviously, patient access. It's improving even, care team access. It's enabling remote diagnosis and care, especially, in the time of the pandemic. We've seen the importance of such technology in helping reducing the pressure on the patient care facilities, and it's facilitating virtual clinical trainings. I can tell you we've done a lot of, trainings remotely throughout the pandemic. We continue to do so. There's also a lot of surgery procedures are now being done leveraging, capability like 5G and remote access as well. But also these type of technologies that are helping transforming, if you wish, the day-to-day working of a healthcare institutions, tasks like inventory management, stock management, medical device distributions and tracking. They're freeing up clinical and non-clinical staff to focus time and efforts on delivering, best care for patients. So again, it's a huge element of how technology and digitization is actually impacting healthcare. In collaboration with Apple, we're investigating the early detection of AFib, the atrial fibrillation. So to improve the early diagnosis and the patient outcomes. I mean, there's a shocking numbers today. We have up to 30% of AFib cases. They go completely undiagnosed until you have a life-threatening complication. And again, this is an important element how technology can actually be leveraged and used, not only to treat, but also to early detect. In the past, this was absolutely impossible. And we had to wait until, complications actually occur before a patient gets rushed to the hospital. And sometimes some of them don't even make it to the hospital. So again, how do you leverage technology to only to improve access and treatment as well? If we take a look, companies like Microsoft, Google, Facebook, and Apple, they probably know us better than we know ourselves. They have the data, they have the bandwidth, obviously they have the computing power to process our information in a way we would never be able to actually do it ourselves. So if we take a look at how Google and Facebook and Amazon, they harness data, they're able to articulate, what people, or in our case, is patient, state of health. So Apple probably can tell you, what's going on if somebody has an Apple Watch when it comes to some of the vital signs of their health. They can understand their behavior and preferences probably much better. They know which doctor they visited. If you ask Google, they probably tell you, where patient visited, which hospital, which doctors, how many visits they've done, which hospital they have actually switched from, and so on. And this is all powered by data, by AI capability, and obviously supporting technology. And I always give this example. It's a great example. In the past, people used to actually read books. Now books are actually reading people. If you take a look at Amazon understand, which book I am reading, which chapter I am on, how fast I read, maybe where I stopped reading, and whether I ever went back and finished that book. And if you apply, face recognition cameras to the likes of Kindle, Amazon can also, tell you when I laughed, when I cried, and maybe when my, heart rate and blood pressure went up while reading the book, and so on. Such information, obviously, Amazon can leverage to, to do insights and analysis on my preferences as a customer, and potentially provide future recommendation. Now, if you ask us with our limited human power, and short memory, I can't even remember, what kind of products I bought from Amazon in the last week or maybe in the last month. But if you, with a press of a button, Amazon can create maybe 20 pages of analysis of my behaviors over the last, I don't know, 10, 20 years of my interactions with the platform. So again, how can we leverage data? In our case, is to improve, patient outcomes and access to care. Now, there is an element with technology and trust. Trusted technology is absolutely key in healthcare. Many other industries, they've already gone through that and they trust technology, but in healthcare, we seems to be lacking behind. Today, we trust Google to tell us what's true. We trust Facebook and Instagram to tell us what's going on and what's new. And we also trust Google Map to find the best route for us, when it comes to destination. They have the data traffic, they have the congestions, they have, the entire data that will allow us to actually reach our destination, as quickly as possible and as fast as possible as well. So again, we trusted Google in the past. We used to rely on the physical map or maybe the directions of our significant others, but we've learned over time that Google is much more effective, than any other directions we used to get, and we started to trust those technologies accordingly. Now, every patient is becoming a big data problem. There's so much information, and the human brain is just so limited, and it cannot handle, one patient, let alone maybe thousands and millions of patients. So the future of health relies on the notion of artificial intelligence, and obviously the capability of intelligent systems, not only to comprehend the world around us, but also to make it also very personalized and comprehend the specific diseases and the specific patient as well. And if you take a look, there is also this discussions about data and privacy. So data got, value for us as individual, and this is very important, but also data has a value for the greater society, the bigger society. It has value for patient, it has value for customers and physicians, but also it has a value for world at large. So how do we, do it in a way where we are not in a position to choose between either the data privacy or a better patient outcomes? And we should be in a position where we can actually leverage both. How do we securely, safely leverage data, not only to protect the privacy of the individual, but also to harness the data to improve, the overall well-being of the society and the citizens of the society as well. So combining both is absolutely key. And I always give this example. It's a great example. Angelina Jolie, and we're not talking about Angelina Jolie from a film industry, but her mom died from cancer, and she had a gene mutation, which basically, her chances of actually getting cancer was around 87%. So she leveraged data and AI to actually analyze that gene mutation that she had. And because her mom died of cancer, she had that same gene mutation. What she did, she preventively, so she had absolutely no sign of cancer. She had no pain, no symptoms. But because of the gene mutation she had and the data that she leveraged, she preventively went into double mastectomy. And she lowered her chances of actually getting cancer from 87 to 5%. So again, how do we move from sick care, not only to proactive care, but to preventive care as well? And it's something we really need to look into. It's something very powerful, and we already have some examples we can rely on. Now, there's a lot of discussions about innovations and technologies and applications and assets and so on. And we need to differentiate between asset and value. And what I mean by this, when we fly, and in this example, when I fly Emirates, I honestly don't care about whether I'm flying Airbus or Boeing. I don't care about whether it's a 777 or A380. I don't care about the number of seats, the captain, nationality, British, Canadian, Indians, he has blue eyes or green eyes. All I care about is the safety of the journey, and I care about the overall experience that Emirates provide. So I'm more interested in the value Emirates provide rather than the assets Emirates bought from Boeing or from Airbus. Again, the analogy, if we apply the same analogy to healthcare, it's not the assets that we have, it's how we leverage the assets and the technology to provide and deliver value. Now, when it comes to digital surgery, our mission is basically to shape the future where we have medical intervention is smarter, less invasive, and obviously much more personalized. And we look at this from an end-to-end ecosystem that combine obviously the great minds that we have, the innovation, the expertise, but also the services and solutions that we offer. And if we take a look at this, it's the collective ecosystem that makes the difference. It's the next gen robotics, it's the advanced visualization and instrumentation, it's the connectivity, it's the OR standards, workflows and patient pathways, it's the data and the analytics we leverage and so on. It's not one element, but it's the combinations of the entire ecosystem that comes together. So, and it's a very powerful importance because sometimes we tend to believe that if we only focus, for example, on robotics, then we can actually move the needle. In fact, we need all the elements to work together to deliver that value. Now, there's so many, obviously, innovations and technology. I don't want to spend a lot of time talking about it, but I just want to touch on maybe some of them just to understand how we're moving as a society. Now, if we take a look at this from many don't realize today, lung cancer is probably the leading causes of cancer deaths globally. And we're looking at 1.8 million deaths every year. It's a very serious healthcare issue with a huge area of unmet needs. And anything we can do, for example, when it comes to curing cancer or detecting cancer early is absolutely key. And again, this is a great example how we leverage technology. So we have a better reach when it comes to accessing the lung peripherals. How do we maintain, high vision as we go through the intervention, but also how can we have very precision control when it comes to the micro movements and the precision targeting of the treatment. Again, great examples of how technology can help us address some of the unmet needs. Also, a great example is how do we move into borderless or collaborative care? And I think, the pandemic has definitely accelerated this. So imagine if we have a cancer patient in Jordan sending a tissue of his cancer tumor to an AI or a 3D imaging center in Dubai, and that is specializing in that precision diagnostic, and the Dubai Institute establish, some sort of clinical trials with another institute in the Netherlands. All of a sudden, you have the same patient getting treated and healed by collective effort of integrated and well-connected healthcare system that are completely outside the typical geography that we are traditionally used to. So how do you bring collaborative and borderless care to deliver better patient outcomes as well? Now, today, surgeons and radiologists, they used to rely on a 2D black and white patient MRI and CT scan, but with the latest technology now, all of a sudden, we can improve the delivery of care. So we take, 2D black and white image, we run them through an AI algorithm, and all of a sudden we have, 3D digital model where a surgeon can actually leverage to plan the surgery much more effectively, but also to deliver the surgery much more effectively. So such technology provide clearer roadmap for surgery, not only for better diagnosis, but also for better surgical planning, treatment, and ultimately patient outcomes and cost. And you can apply it obviously to different diseases as well. Now, if we take a look at other technology and how we're blending, our leadership when it comes to orthopedic innovations, and also how we're accelerating focus on enabling digital technology to advance the patient care. The Valis is a great example. It's a platform of connected technology powered by data as insights. So you can have, greater insight before, during, and after the surgery. It's a very thoughtfully designed and elevated orthopedic technology, which obviously improve the patient experience and the outcomes as well. Again, I don't want to drill on it much, but I mean, you get the elements. It's basically, it gives you the capability that you need both to personalize the care. It gives the care team, the access and the ergonomic they need in the OR. It allows to leverage data much more effectively, and it brings together that very well connected environment that usually surgeon needs and the overall care needs, be it, in the pre-op, in the intra-op, and obviously in the post-op. If we take a look at technology as well, like CSAT, we have the data and technology working together to actually empower surgeons and clinicians, both from skills and competencies. So all of a sudden now we have, videos from surgery being analyzed by key opinion leaders. Feedback is actually given to actually improve the surgical skills and the outcomes. And obviously there is a huge improvement when it comes to accelerating the learning curve of the surgeon, augmenting obviously the surgeon knowledge, but also the interoperative judgment that they need when it comes to enhancing the overall patient outcomes. Again, there's a lot of data. You can definitely go and take a look at it, but just to give you an indications about how this has improved the length of stay, it impact obviously, it lowers the risk of conversion to open surgery, and obviously it helps reduce the risk of blood loss and many other benefits as well. Now, if we look also from OR perspective, there's a lot of technology that are actually, especially now with the pandemic, it's also allowing clinicians to actually have instantly get remote assistance and access without any interruption of the surgery. So all of a sudden you have, surgeon in location A getting support by surgeon in a time zone, which is 10 hours difference and so on. And collectively they're trying to work together and collaborate together to improve the outcome of care and to deliver that surgery safely and efficiently as well. Look, I think the important element here, how do we move? Sorry, can you still see my screen? Okay.
There, now it's back.
Okay. Sorry, so going back, so I think the important thing is when we look at the largest picture when it comes to healthcare, how do we continue to leverage our scale, our partnership, our size as an industry to actually address some of those unmet needs? And how do we look at, the priorities when it comes to delivering care? Now, today we have more people dying from sugar and obesity and cancer than from gunpowder. We need to understand what those priorities are, and we need to see how the society can actually come together to work on these priorities. I honestly believe, especially in a very complex industry like healthcare, it's a very highly regulated industry. It's very complex, and obviously we have so many challenges, but it is a solvable problems. Together, I think we can definitely innovate. We can make a difference to solve many of these problems. We don't need an act of God. We don't need a Nobel Prize. And I think collectively, we can address and move the needles on many fronts. Now, I just want to leave you with a few thoughts just before we actually conclude. I think it's very important we realize we have changed as an industry and as a society. Digital innovation is something we can definitely leverage as a force of good. We need to make sure we drive priorities and collaborations across the ecosystem. How do we leverage partnership not only within the healthcare industry, but also beyond? How do we create shared value, starting obviously with the patient? And also, how do we leverage data safely and securely? And most importantly, how do we maintain learning mindsets in everything we do and deliver, especially in healthcare, so we can actually leverage innovation and leverage digital technology? And obviously doing so, keeping patient at the heart of everything we do and deliver. I hope this has been informative and useful. It meant to just give you a bit of an overview of what's going on when it comes to healthcare, but also to zoom in on some of the key areas of special focus and needs. And I look forward to the interactive discussion later on. Thank you.
Thank you, Ahmed, for a fascinating presentation. It was excellent. The concept of digital natives and the ability to do digital surgery, and how it all comes together in a value ecosystem, and the concepts of borderless care. I mean, these are all some fascinating things. So thank you for that wonderful presentation.